Hello everyone, welcome to my YouTube channel Medical X. Let's discuss I am seeking of medicine. Here, a case was given. A 24-year-old woman presented to the emergency department with the chief complaints of left-sided chest pain and breathlessness, which proceeding over 4 hours, and the pain worsened on inspection. And she also gave a history of smoking history, 10 cigarettes per day, but she has no any significant past medical history. The only history was our regular medication, that was oral contraceptive pills, and on examination, her temperature was found to be 37.4 degrees Celsius. Her BP was 95 by 60 mmHg, and pulse rate was found to be 120 beats per minute. On further examination, our oxygen saturation was found to be 89 while breathing air and improved up to 96% when oxygen is given at 40% of FiO2. On chest examination, the chest examination was found to be normal. And from the above clue, what is the most likely diagnosis? Enlist your answer. Option A, left lower lobe pneumonia. Option B, myocardial infarction. Option C, pneumothorax. Option G, hyperventilation. And option E, pulmonary embolism. Let's discuss the answer of this question. The correct answer is pulmonary embolism. At first, discuss in the above clue there are given the two risk factor. The two risk factor were the exposure of the tobacco, 10 cigarette per day, smoking history, and another one is the oral contraceptive pills, which causes the thromboembolism. Clinically, she has presented with the acute history, so that may be also compatible with the pulmonary embolism, but can also be compatible with the other diagnosis such as the pneumonia and pneumothorax. But the normal examination finding on the chest that make the diagnosis of pulmonary embolism much more likely. Otherwise, it would be anticipated that there would be an abnormal examination finding if she was presenting with the pneumonia and pneumothorax. On case of pneumonia and pneumothorax, the chest finding might be abnormal, but she has the normal finding, so we thought it might be the pulmonary embolism. And the patient with hyperventilation can have the normal examination finding, but not with hypoxic on air, and conversely, abnormal or potentially supranormal oxygen saturation, which would again make a diagnosis unlikely. The clinical history is not suggestive of the EMI. There is no any significant EMI history, and it will be very unusual for a patient of this age to present with the myocardial infarction. So from the above clue, due to the mainly given the two history of exposure, one is cigarette and another is OCP, and another one is the normal chest finding, which is not typically seen in the pneumonia and pneumothorax, and due to the acute presentation, it must be the diagnosis of pulmonary embolism. Thank you.